Ellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency, and we're servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. And tonight, our special guest is Dr. Alan Patterson, who is an OB-GYN. And he is right here, local in Coral Springs. The address is 7451 Wiles Road, Suite 205, Coral Springs, Florida, 33067. And you can reach him directly at 954-755-9311. And the website is www.obgynpatterson.com. Thank you so much for joining us today, Dr. Patterson. We appreciate you. Hello? So, we might have lost him real quick. So, just to get everybody a heads up, Dr. Patterson is an OB-GYN. He's been in practice for many years. And again, you can reach him at 954-755-9311. And the web address is www.obgynpatterson.com. How are you today? Are you there, Dr. Patterson? Okay, so we are experiencing some technical difficulties. Not sure what happened. Let's go take a quick commercial break, and we'll be right back. How about that?
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome to AMP2 TV, the first and only internet production company that's truly plugged in. When you're looking for a full-service internet radio, TV production company, discover AMP2 TV. AMP2 TV is a full-service media company that can provide all streaming videos, video studios, radio studios, and television studios. Call us today at 866-224-5422, for no business is too small to grow to be accounted. It's time for your message to be seen. Let Ant2 TV help get you there.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist.
Hi, Dr. Patterson. Are you there? Sorry, we had a little mishap. Hello? We can't hear you. No. Okay. Well, we are experiencing some technical difficulties, but we will definitely see if we can get him back on. In the meanwhile, let's talk.
Patterson,
Let's talk to Freddie.
Dr. Patterson changed his location,
Okay.
and that forced his phone not to work or whatever he's using. So he can't hear you, you can't hear him. So I'm gonna stall here for a little bit to see if we can get Dr. Patterson back on.
Yeah. Okay. Well, we'll definitely do that.
I wanted to share something with you.
Yes, please do.
I've been doing this show for 7 years.
Wow.
7 years.
Okay.
We've been doing this show on the air, and we've been bringing all sorts of good stuff to the public. We've done it on location. We've done it all over the place. You have been with us a year.
It has been already. Wow.
It's been a year. And I just wanted to
Amazing.
take a couple of minutes to say nice job.
Thank you so much. I appreciate you,
And
Freddie.
things do happen because this is live feed. This is not
Yes.
tape. This is not a delayed tape.
Yes.
And sometimes our guests, they get lost in the sauce.
Yeah. So, All County Healthcare, I've met the owners. I've met a lot of people on their team. What can we speak into about All County Healthcare? Because I know you've been with them for many, many years. What
Many
is-
years and a few owners.
Okay.
A few owners.
So, what has been your experience with their providers, with their team, and with how they support the community?
Actually, Dawn's parents have used
Okay.
All County.
Wow.
Ed Salazar, who does the pulmonary, the COPD stuff, I've worked with him as well. They have all types of things that they deliver to the community, which is amazing. But they've always been on point. The people that work there have always been on point. Delroy, the owner, always been on point. Always cared about the community. I mean, they've treated you and me and everybody
Yes.
else like royalty.
Absolutely.
And it's been a blessing to have them on the air. But they provide a service that is needed by many, many, and they've done a good job of doing that.
Yeah, and I know they're also expanding. I mean, coming into the new year, they're looking to hire more OTs, PTs, and more staff to help service the community because we're servicing Palm Beach County, Broward, Miami-Dade. That's a big population
It is.
of people. So,
And it's funny because John is always here. And tonight he's not here. He must be partying.
yeah, he had a prior commitment he had notified me of, and everything supposedly was going to be on point, but things happen. This is how life is, right?
You see, in rehearsal, everything went well.
I know.
You
We
see?
checked. We
We
checked.
went into the back room, we come out, and it's all gone.
We checked everything. Sound, everything. Well, I know Dr. Patterson, like I said, he's right here in Coral Springs. He's an OB-GYN, doing it for many years. Definitely people can check him out at www.obgynpatterson.com, right here at 7451 Wiles Road, Suite 205, Coral Springs, Florida, 33067. Many, many years of experience and many different types of patients that he has, too.
Absolutely, absolutely. And it's good that they're affiliated with All County. Now, do you have how to reach All County if people wanted more information
Yeah.
on their services?
So, yep. you can reach us at 954-717-7027. And the website is www.allcountyhealthcare.com. So you can check us out, learn a little bit more about how we're helping provide for the community. I mean, the community is...
You have a phone call coming in now.
Okay.
But I know a season's coming and people start coming down to visit families. Accidents
Yes.
happen, right? There's slip and falls, things happen, parents get sick. And I know when my parents were both in the hospital, All County has been amazing. They've come to the home. Freddie knows we worked with them for a long time.
Wow.
They took care of my mom for months and months and months. They lived in sometimes.
Wow.
They did daycare. There's 12-hour shifts, 24-hour shifts. Pretty much anything you need, All County can take care of.
Wow. So they're...
It's like she said, she's used to service. She knows exactly what
great
they do.
Multiple
testimonial.
times. My mom had open heart surgery a few years ago. We used All County. She had a live-in, and then she went back to doing her life. And then again, she had another fall, and All County came in and took care of them. And now they've got full-time live-in.
Wow.
And All County's always incredible. I think you have a phone call.
Thanks for that
Yes,
testimonial.
let's go to ISO. Good stuff.
Okay,
All right,
thank
I'll get
you.
out of your way.
All righty. Thanks for that testimonial, Dawn. Dr. Patterson, are you there?
Hello?
Oh, hi. We have you back. Thanks for tuning back in, Dr. Patterson.
I never left.
Oh, I don't know. Something happened. There was a glitch. Something happened.
On
I'm
your
not sure.
end. Something happened on your end, so we'll just talk by radio. I've been here the whole time waiting, talking, calling
Okay.
David, calling your boss, calling everybody.
Oh, okay. I'm so sorry about that. So let's get into it because
No
we've
problem.
already... Yeah, we already got into some, information about you. So just can you tell us a little bit more about your background and your studies, where you went to school, and a little bit more about that?
Sure, yes. I went to Tulane undergraduate in New Orleans, graduated 1975, Phi Beta Kappa. Then I
Nice.
went back, I'm originally from Indianapolis, Indiana, so I went back to my home medical school because that's a great medical school, and it was a little cheaper than Tulane Medical School since I would have been out of state, went to Indiana University Medical School, and then I did my internship and residency at a large private hospital in Indianapolis, St. Vincent Hospital and Healthcare Center. I practiced in Indianapolis for 8 years. Then I moved down here in 1991, joined somebody for a year, and then I've been by myself since 1992. I'm one of the few OB-GYNs in private practice. Most are in large groups because they can't stand everything that has to do with the private practice
Right.
because it's a lot more work. But for me, it's the only way to go. Part of a large group, you're not always there. I'm there 24/7 for my patients. So they appreciate that, and they know they're going to see me for all their visits, and I'm doing their delivery, not one of 6 or 7, like in a large group or who's ever on call.
Wow. So you have a lot of experience. What made you want to get into, when you were in medical school, what made you want to do OB-GYN? What was it, an experience that you had?
Because it was a combination of medicine and surgery. You get to do both. And I enjoyed delivering babies. I delivered my first one when I was a junior in med school. I got to do one delivery. And then
Nice.
after that, I decided that's what I wanted to do because it's a specialty that you can help prevent things from happening. You get to work with women of all ages. And so it's not just one subset of the population other than it's women, but it's everything that I wanted in medicine because I didn't want to do all just medicine and all just surgery. So it's the balance of both because of my specialty. You do both.
Nice. So, Dr. Patterson, can you tell us why is it important for women to have routine checkups? Because sometimes, we tend to let it ride for a few years. But what is the importance of that?
Right. A routine checkup is very important. Number one, most major insurances cover that without a copay. So, it's good for the patient because they have no copay for the visit. It's covered 100% by almost every major insurance. And it's important to go for your routine checkup because even though the OB-GYN is not your PCP,
Right.
you will discuss other issues with your OB-GYN, that he may find something that's wrong with another area of medicine, that he can refer you to somebody that you will need to see that you haven't seen. But it's important to have a yearly breast exam and pelvic exam, because I picked up asymptomatic breast masses. I picked up many pelvic problems that were would have been undiagnosed. If they hadn't come in for their exam, they would have been much worse and caused a much worse problem. And you can obviously talk to the doctor about family planning, if you want to get on birth control, if you want to get pregnant later, if you have any issues that are bothering you, because then from the well woman exam, we can do a workup of other problems that may involve blood work, cultures, ultrasound. So if you don't come in for your yearly exam, which is covered by your insurance, you could be missing other issues, or maybe you have something that's bothering you, but you haven't talked to the doctor about it. So that's your chance to express it to your board-certified OB-GYN, whatever your issues are. And for my patients, whatever I can work up, then I'm going to work up. If it's something that is outside my area of expertise, whether it's in my specialty or another specialty, then I will find the best doctor to refer my patients to. And that's why my patients go to me, because I have the experience and I know all the good doctors in the area. I will refer my patients to the best specialist for their problem, not necessarily my best friend who may or may not be the best specialist.
Mm-hmm. So you really just explained I was going to ask, and you already answered it, like, how does regular gynecological care contribute to preventative health measures? And you really explained it, because you're there, you're able to detect certain things and then refer, which is really good. Because I do know personally some women who haven't gone for 3, 4, 5 years after COVID, because you remember what happened during COVID. A lot of people just kind of said, oh, I'm doing fine, and they kind of let it go. And so,
Right, no, that's a problem, and I
Right.
encourage them to get in there now,
Right.
because they need their uro exam. They may have something that's undiagnosed that they come in now, then it can be treated without causing a large problem. And a
Right.
lot of people may be behind on getting their mammograms, which is very important, because if they have early breast cancer, you want it to be normal, but
Right.
if it's not normal, the whole idea is finding it early, because early stage breast cancer is very curable, whereas once it spreads, it's not. So it's a huge difference.
Right.
And some of those people are going to be coming in too late. So I encourage all women to take advantage and come into your OB-GYN, even if you're self-pay. I give my self-pay patients a very competitive price. I try to
Nice.
give them, if I have samples of things, like I get samples of birth control pills, brand name, because I actually talk to drug reps, because I find out good information from them that other OB-GYNs don't, so they don't get samples. So
Right.
somebody self-pay, or somebody needs a few samples because their paycheck is not as big as it used to be because of certain factors I won't get into, then I try to help them out and give them samples, which is important for them, and I'm happy to do it.
Thank you for that. Can you highlight some maybe specific screenings or tests that women should discuss with their OB-GYN, and why is it important to address them openly?
Sure. Yes. I mean, obviously any kind of you want to have breast screening. So women under 40 should be doing monthly self-breast exams, or at least every other month at the least. And you should check your breast after your period is over to make
Right.
sure you never feel anything that's abnormal. And then with the yearly screen, you're doing a pelvic exam. So if you're under 21, you're not supposed to get a pap smear. But if somebody is sexually active, we do cultures to rule out gonorrhea, chlamydia, and those people need to be on some type of birth control, because this country does not talk about enough. Just say no if you don't want to have intercourse.
Right.
And if you're not ready to have a baby, you should get on some kind of birth control, which is preventative. So you prevent an unwanted pregnancy, so you're not left with that situation to deal with. So it's very important for the yearly exam. And then we do a pelvic exam. Every once in a while, I might feel a mass, which could be a fibroid or an ovarian cyst, that once we diagnose them, we can treat appropriately, because if they're not diagnosed, somebody could end up in the emergency room with a bad problem. So it's very important for the screening. And I recommend pap smears once a year. A lot of People recommend them every 3 years, but I've seen a pap smear go from normal to cancer in 1 year. So if somebody's sexually active, I recommend that. And some people that aren't going to come in for their pap smear once a year, then aren't going to come in for their well woman exam, and they could miss another problem. Example, you look at the outside.
Right.
I picked up brown lesions on the outside, referred them to the dermatologist, and they were pre-malignant melanomas, where if they hadn't come in, that
Right.
wouldn't have been picked up, and it would have turned into a melanoma. So that's a skin problem that has nothing to do with your pap smear. So
Right.
that's why it's important to come in once a year, because a good board-certified OB-GYN will check all of those things, look at the outside, check the inside, do what needs to be done. And if you have other problems that aren't in his specialty, then at least he can point you in the right direction or refer you to the right specialist, so you get in to see somebody to treat those problems. Somebody may come in to see me for a routine. They may have high blood pressure. Well, then they
True.
need to see their PCP, or they need to get a PCP to get on medicine to treat the high blood pressure.
True. You know, interesting that you mentioned that you do a pap smear every year. I've met other friends who've told me, no, my doctor doesn't do a pap smear every year. He says to do it every other year. So I'm
Well,
glad
a lot
that
of guidelines say once every 2 years or once every 3 years, but I've seen things get worse. So if the insurance covers it, I do it. There are some insurances that don't cover it.
Right.
So I don't do it on those people unless they sign a waiver, because they'll have to pay for it. So we let people know what their insurance covers and what it doesn't cover, and then I treat them appropriately. If somebody wants to come in and they don't want the pap smear every year, I don't force them to have it, but I'm still
Sure.
going to do their examination,
Right.
because you're checking other organs besides just doing the pap smear. So
Right.
the main point is that the well woman exam is much more than just the pap smear.
Right. So for women planning to start a family, what questions should they ask their OB-GYN before conception? What suggestions do you have for them?
Well, for women starting to want to plan to have a family, they want to make sure that they're ready to do that. They want to make sure that they don't have any undiagnosed medical or surgical problems that need to be treated, because if they do, that should be treated before they're pregnant, because it's much easier to deal with that
Right.
before pregnancy and get the medical problem under control, or have the surgery than have to have emergency surgery while you're pregnant. So that's a very important thing for women to consider, that if something's been bothering them, they could tell their OB-GYN, and the OB-GYN can refer to the appropriate specialist, so the issue gets taken care of. Then when somebody wants to try to get pregnant, they want to be on prenatal vitamins and extra folic acid, because folic acid prevents neural tube defects, and that's something that they can do preventative. And then they want to make sure that they're having relations at the right time when they ovulate, so I instruct them when the right time is, and they want to check to make sure they are ovulating,
Right.
because one of the most common causes of infertility is lack of ovulation. So that's the easy thing that the woman can do at home when they're
Sure.
trying to get pregnant, because if they're not ovulating after, like if they do it 3 months in a row, check the ovulatory strips, and you're not ovulating, then you need to see the doctor, because you're just wasting your time. And I don't like my patients wasting their time,
Right.
because it's very frustrating. It's one of the most frustrating things when you're
Yes.
trying to get pregnant and
Can
not being
imagine.
able to get pregnant. So I'm more aggressive in treating patients. The definition of infertility is 12 months, but I tell most of my patients, depending on their age, to come in after 6 or 9 months, so we can start the workup,
Right.
because
Makes sense.
that would be better than waiting the entire 12 months and then wasting that time and becoming more frustrated. And I start the workup, and if there's something, if it's the point that I can't do it, then I'm going to refer them to the best reproductive endocrinologist I know, who has the best pregnancy rates, because they get them pregnant and they refer it back to me. So I
Right.
do what I can, but I don't do what I shouldn't be doing, like some OB-GYNs, and then they don't get pregnant. They just keep coming back to see the doctor, which isn't right.
Frustrating. It could be frustrating for them. Dr. Patterson, we have 1 minute left. Do you have any final tips or advice for women on how can we proactively engage in better health practices?
No, I mean, you just want to practice, have a good diet,
Yep.
take the proper vitamins, see your gynecologist yearly for your exam, and also your PCP for
Yeah.
regular history and physical, because they're doing different things than your gynecologist. So you want to make sure you're getting your well woman exams, watch your diet, eat healthy. There's certain things that are bad for you, so you want to stay away from those. Obviously, smoking is terrible.
Sure.
So if you're smoking, you want to try to get help. You know, if other drugs or problems, if that's an issue, you want to try to get help for your own health. So just having a healthy lifestyle and seeing your doctor once a year, at least for your well woman GYN exam and your well woman basic exam, is very important for women's health.
Yep. Thank you so much, Dr. Patterson. We appreciate you coming on to the show and doing what you do. Anybody who wants to reach Dr. Patterson, please 954-755-9311, and the website is www.obgynpatterson.com. Thank you so much, and have a great evening, everybody. Take care.
Thank you.